Dr. Jayshree, questions for you.
Yeah, so 90% of the times the body's defense mechanism is capable of getting rid of the infection. However, only in about 10% of infected women, the virus tends to persist. But that depends on various other reasons as to why the virus persists. So there are some cofactors which can actually aid in persistence and progression of the viral infection. So supposing you're a smoker and you tend to get infected with HPV, your chances of HPV persisting and progressing or progressing is 2 to 3 folds higher. Similarly, if you had many children, so if you've had more than 6 full-term births, then your chances of getting the HPV persisting and progressing is 5 folds more. In addition, if you have been using birth control pills, then your chances of for more than 5 years, then your chances go up by 3 to 5 fold. Also, if you had some other sexually transmitted infection, as for example HIV or gonorrhea, or if you are on treatment or some other immunosuppressive treatment like steroids and etc. for other diseases, then also the chances of HPV persisting and or progressing is 2 folds. Also, now as Dr. Jyoti mentioned already, so your sexual behavior and the sexual behavior of your partner also plays a very important role in acquiring the infection. So that means, once again, I would like to reiterate that if you have multiple sexual partners, then the chances of acquiring HPV infection goes up. However, everything is not very bad because you have some other cofactors which help in preventing the progression and persistence also. Next slide, please.
Yeah. So, we'd like to know what can decrease the risk of progression from a behavior point of view.
So like for instance, as Dr. Jyoti has already mentioned, first of all, good genital hygiene, good nutrition in the form of antioxidants and vitamins, and of course, regular screening. So I will come to that a little later as to how important screening is.